Okie dokie. Where the page freeze up. All right. How are you doing? How is your Sunday evening going? I'm Stacy. Welcome, welcome, welcome. All right. Hopefully I'll get a few more persons on the live where we can talk a little bit. In the meantime, let me just fix up my hair, depending on when you guys are watching this video. Hi, Monty. How are you doing? Thank you for tuning in. How's your afternoon? Or I don't know where you're at right now. Wondering how is your day going? Mine is not so bad. It is almost 3 o'clock. It is, 10 minutes to 3? Yeah. 10 minutes to 3, even though it feels like probably like around after 5 in the evening. But that's the time now. I think probably because of the time, you know, we would have dropped back 1 hour the other day. So it still feels a little bit weird, but it is okay. But yeah, it just feels more like in the after 4, 5 o'clock in the evening. That's the kind of vibe I'm getting. So I was washing, or still washing. I just had dinner, so that wasn't bad. Belly kind of full. Yeah, so feeling a little bit sleepy. You know, that sometimes happen. Address my claim. What claim? Welcome, Hall 95.3. Shout out from East Oakland. Okay, okay. Where is that? Is that in the States here? Which state is that? East Oakland. I'm in Texas right now. So welcome, welcome guys. How are you doing? All right. Oh, California. Okay, nice, nice, nice. You know, I have my nursing California license. I've never done a contract down there before. Yeah, I did got my California license, but I never pick up any contract down there. Initially, I wanted to do one of those COVID contracts, but yeah, when I look at it, it never really was going to be working out in my favor to be taking an assignment down there at the time, because in my little area, there were really good contracts that were paying almost the same amount of money, and I wouldn't need to be spending any on rent when I go to California. So I was like, yeah, I'll take the ones that are here. And there were smaller hospitals. So it wasn't anything, you know, big. SR, nothing much. How are you doing? What are you up to for the day? How is your family in Jamaica? Oh, guys, welcome, welcome. I see 10 persons on the live. Remember to go ahead and tap up the live. I also have, just in case you're a nurse or you're interested in the nursing field, I did create another page just because I'm doing live streams on TikTok. And on this page, I have, I do a bit of everything. It's because it's, you know, nursing, travel, and lifestyle. So I created another page because some of the folks were having a bit of a difficulty with finding some of the content. So I created a page over the weekend where I'm specifically gonna post all the contents, like the teaching contents related to nursing on that page. So it's a little bit easier for persons to find. So if you are able to support the page, go over to that page. It's ThinkNursing Pro. It's one word. Subscribe, share it with your friends, your family members, anybody that is interested in nursing. Yeah, as I say, I'll talk about nursing on this page just the same. But in terms of like NCLEX questions, things like those, tips, anything to do with nursing school, tips, I'll post it over there. So the nursing students, persons who are planning on doing NCLEX, they can have all of that content in that one area rather than coming on this page where I have a little bit of an interview going on. We call it like a podcast. I also talk about traveling, a little bit of traveling. I also have nursing content going on, but mostly vlogs. And I do a lot of live stream, TikTok live stream, where we do the NCLEX questions. So I'm gonna have those individuals go over to that site to have a designated area for them. So all right. Hi Kate, welcome. Minnie, Mary, Minnie, welcome, welcome, welcome. All right, Marvin, Wagwan, how are you doing? How is the weather are you in Jamaica? How is the weather down that side? All right, so definitely go over to that page and subscribe, follow, and watch the videos. Because I know sometimes we might subscribe to a page and we subscribe because of different reasons. Totally understand, appreciate that. But I need the subscribers over there so the page can actually get a little bit more attention. So that's all. All right, so it's Think Nursing Pro. Oh, I should probably try and pin it. I'll pin it in the section there. So persons can just have a dedicated page for that content. How do I do this? Okay. So yeah, but that's that's about it for my day today so far. That's about it for my day today so far. I've been watching the news as usual of Jamaica. So I do want you guys to support in as best, however you see it fitting, whether through prayer, just by supporting my GoFundMe page. It can be supporting the Jamaica. So what's it called again? It's a website for accepting donation in Jamaica. So supportjamaica.gov.jm. You can go ahead and support through your donations. I know at different states, they're having individuals coming together and putting items together for shipping. So if that is something that you're able to do, you're more than welcome to find one of those drop sites and send your packages to Jamaica. But may I tell you, they really need it. They really need it. So yeah, I was supposed to I sign up with this volunteer aid. It's like one of those services. I signed up with them. I was a little bit excited the other day because they did reach out, and they were saying, oh, the next batch of persons that they'll be sending to Jamaica is gonna be around the 20th to the 27th. So I was really, really excited because they were asking about like your passport, if you had like your 6 months on it, and just say that they were gonna give you an update regarding the trip. So it was nice to hear from them, but then I hear they sent another email to say that in terms of like housing, I guess in the areas that they're trying to get persons deployed to, they don't have enough housing available in the country. So they have to kind of cut down the list a bit. So I'm not gonna be on that one, unfortunately. But we know that with the hurricane and all of the healthcare workers in that, especially that area of the island that is being affected, they're going to be like burnout, so they're going to be tired and they're going to need relief. So they're saying that later on in the year or even next year, they're still going to need assistance. So, but I'm a little bit disappointed that I'm not going to be able to get a chance to go down. And then from there, really wanted to do it with one of those volunteer companies, like, the AIDS, the international AIDS, because they would have had like something a little bit more structured. So rather than me going on my personal time and trying to figure out, okay, then where do I go to try and get some assistance? And then in terms of transportation from where I live to those parishes, it's going to be a little bit tedious or difficult. So it's like, no. So I really want to go with the international aids or the volunteer companies or the services or aids, rather than using my personal time and just go down there and not knowing what exactly to do. So, all right, Rylando, thank you so much for sending that $500. All right. But yeah, so that's just it right now. So I don't know, but I'm still thinking about it. But as I say, I just don't want to show up to the country and not have anything like, structured plan for if I say I'm gonna go down there for 5 days or 7 days, that kind of vibe. I don't want it to be a case where I just show up and not knowing what exactly to do. I want to have things structured, outlined for me to do as soon as I reach down there. So that's just it. But yeah, but do go ahead and support as much as you possibly can the victims or the island itself, because they're really in need of support at this time. And as I said, I have my GoFundMe page. Go ahead and donate if you're able to do so. If you're not, I totally understand. Feel free to go ahead and support on the website in Jamaica, which is the supportjamaica.gov.jm website. And you can do your donations there, and I'm sure everyone will appreciate it. Of course, Phyllis, of course you can tell me something. Go ahead. All right, but thank you guys for tuning in. Oh, remember to just go ahead and tap up the live if you don't mind. That would be nice. All right. Yeah, but the damages, it's awful. It's awful down there. It's awful. Sometimes I'm seeing some videos and I'm wondering if it's really just an hurricane, because it feels like, I just feel like there was a tornado, there's an earthquake. We don't know, because the roads, the amount of destruction that has happened, it's just like awful. It's just awful. It's like one hurricane do all of that, so they really need some help down there. They really need some help. Doxy, no, you don't have anything else to ask? Seriously? I want some mix up. Here's a mix up. But thank you so much for tuning in and typing. I know probably you're not going to type something nice, but yeah, if you come over here for a negative energy, nobody come in on my chat, please. I beg you. All right? We have too much things out there to be worried about, rather than to be asking me questions right now that I don't have a problem with anybody. All right? So Panther Walk, how are you doing? How are you doing, Panther Walk? How is your Sunday evening going? Tango is not here. Welcome, welcome, welcome. How are you doing? Yeah, so that's just it right now. That's just it right now. This guy, Nature and Life Unscripted, they did a video about 19 hours ago showing some parts. What's this? Cave in Westmoreland. Yeah, it's gonna take some time to recover. It's gonna take years for that section of the island to recover. It's gonna take years. I know the hospital, one of the hospitals that I did my clinicals when I was a nursing student, I have a relative that is working at that hospital. So everybody was coming together with getting supplies to the St. Elizabeth area, the areas that have been devastated. And they finally got a chance to go down there, and they were saying like, some of them said them not going back. They don't think they can stay down there because everybody are bald. Everybody is crying. You understand? Everybody's just tearful. Patients are coming in because, they have the field hospital. They have the field hospital. And while the field hospital is able to see, you can only see a certain amount of patients. You still have patients who have their chronic conditions who are showing up. You understand? I'm not talking about like your diabetes, your hypertension. I'm talking about them chronic pain, expecting that they're going to get the same treatment as if there was an actual physical structure. You understand? But right now, they're just trying to see how best they can meet the needs of persons who have real emergencies, your pregnant patients, your persons who, blood pressure is high because of the storm, out of medication, or lost their medications because of the hurricane. But even I hear that even surgeons go down there and they're just like crying. Everybody's just so emotional about the whole thing. So they say it looks more like a war zone. That's the description I get. They say everything is like flat and parched, and it's awful. It's awful. It's a place where you could actually usually drive and you say, Black River. Yeah, this is Black River. No, you can't really tell where on earth you are. Some of the photos I've been seeing, the videos I've been seeing, I'm like, huh? So where are the buildings? Like nothing at all, nothing. So it's just sad. They need the help down there. Thank you so much, Panther Walk. Thank you. Yeah, but we're gonna recover. We're gonna recover. No, right now we're in that, that stage of fright. I think we're still in the stage of fright because some persons are just getting a chance to go back to like their little location where they're originally from and finding out that yeah, it's no more. It's no more. So I don't know in terms of, I know probably they're gonna be doing a lot of temporary housing. Just hoping that there is no severe weather because we're still in the hurricane season, right? We're still in hurricane season. It's November. We're still in that period. So I'm just hoping that there is no like heavy rainfall that will come and cause additional problems for those persons, those individuals. Yeah, so that's just it. And then the rising water, like there are different areas. There's one place I think it's is it Manchester? I think it's in Manchester. So I don't know if it is a matter of, I hear that area, um, um, downtown welcome. I know there's one area in Manchester called like Content, and I think they've had a flooding in that area before because there was a rise in water. I don't know if it's just because of the slope, if it's like a slope. I don't know what it is, but the houses down that side is actually is like engulfed in water right now. So I don't know what is happening. Think of it like a funnel. So the houses are like down here and the water is just rising. So I don't know how far that water is gonna rise to. But a lot of houses are actually covered so far. A few houses have been covered so far. Doesn't seem like the water have anywhere to go. So we just keep on rising because the individuals will be putting like, marking different locations where the water would have been in terms of the height. And when they go back like probably like the next day, they realize that yeah, that marking that they had there is no more, or they can't see the rooftop for some houses. So the water is rising. Don't know where the water is coming from, if it's a spring or I don't know, but that's just it. Hi, 291 Kathleen. Yeah, so I don't know, but it's a lot going on down there. It's a lot going on down there. So if you guys know of any volunteer groups that is doing any recruitment, actively recruiting, and any persons down there, I can give up my, at least I have my 7 days. I can say, all right, I can restructure my schedule to go down there and do some volunteer work for 7 days. Not going to hurt me. As I say, we did it in hurricane, not hurricane, we did it in COVID, where we were working tons of hours for money, with a respiratory problem. I think I can actually do the 7 days or 5 days, 6 days of free service to my country and my people them. Yeah, man, I think I can do it. Not gonna hurt. So I know I work Monday, Tuesday, Wednesday, and that's it. I usually take Thursday and Friday off. So I'm saying I can do Thursday, Friday, Saturday, Sunday, Monday, Tuesday, and then come back Wednesday, then start working Thursday, Friday. Just see some patients on Thursdays and Friday. That Thursday and Friday, and that's it. So I don't know, but some persons are saying, Stacey, you're not gonna be able to. But somebody have to do it. Somebody have to do it. You understand? Somebody have to do it. There is about 50,000 persons that are being affected right now. And how many healthcare workers? Like, somebody have to go down there and do it. So we just have to put on our brave face. At least me, that is. Gonna have to put on my brave face and, just be strong. And go down there and try and see what I can do for the people, my country. So that's just where I'm at right now. All right. Remember to go ahead and hit the thumbs up button. everyone, especially downtown, because downtown come on here asking for persons to support my page. So yeah, go ahead and hit the thumbs up button downtown. Make sure you do that. All right, and I hope your day is going good. All right. And I say, if you're new here, I'm Stacy. All right, I'm Stacy, originally from Jamaica, and I work as a house call nurse practitioner. So I don't work on Sundays anymore, thankfully. I have the Sundays off, Saturdays off, weekdays, not weekdays, holidays off as well. So I have that flexibility and I do love it. Thank you for doing that. So yeah. All right, but feel free to go ahead and ask me any questions regarding nursing, travel, lifestyle. As I said, go ahead and subscribe to my new, my second YouTube page, which is a Think Nursing Pro. That page is created specifically to post all my nursing content. So, for example, I'm talking about diabetes, or I'm teaching, these students or nurses about diabetes, hypertension, NCLEX tips, things like those will be posted directly to that page. So everybody can find the information over there rather than coming and playing, checking through the list of videos I have here on this page that has nursing, travel, and lifestyle. So I'll still do my nursing vlogs on this page, but in terms of the other page, it's not going to be about any vlogs. It's more going to be for educational. All right, so go over there and subscribe. You can watch the content. You can also share the content. And what else? Yeah, and just comment under the video. Comment underneath the videos and I'll respond to them. And I'll try to post one video at least per week. And then from there, is there male traveling in your field? Travel nurses? Yeah. Yeah, you have a lot of travel nurses that are male. Yeah, we have a lot of nurses that are male. In my batch, when I was in nursing school, I was blessed to have the only two, no, it was three of them. 1, 2. So there were 3 male nurses in my batch. And in my group, I was blessed to have 2 of them. The Lord said no. Sometimes we always say wherever too many females are a problem. Yeah, so I was blessed to have 2 male nurses in my group. Yeah, I never knew. I always hear just females. Yeah, you'll hear a lot of persons, especially because men don't really come online and be talking about travel nursing or be talking about anything much like that. But yeah, you have a lot of male nurses. Enough recently there has been like an increase in so it's not female, predominant anymore. It's both genders. So you do have a lot. When you go to the hospital, or when we are working in the hospital, a lot of times we tend to be relying on the male nurse. Everything we say, oh yeah, call John. Even when John is like as thin as a pencil, we're still calling for John because, John is a male. So we tend to be calling for John to help with assistance. But yeah, they're there. They're in the field. Yeah. And you do have a few of them that do travel nursing as well. You have a lot of them that do travel nursing, because when I was doing travel nursing, like when you look at the amount of persons, sometimes they'll be traveling with their, their companion as well. So that is a nurse. Yeah, so you're thinking about coming into nursing, or what area are you in? Oh, so you wanted to become a doctor a long time ago. I just observe sometimes. Okay. Well, it's not too late. You feel as though it's too late for you to still pursue that MD? Is it something that you think is too late, Panther? Yeah, so the other day a lot of persons were asking if 50 years old was too late to do nursing. And I'm like, if it is something that you really want to do, you can. You just probably by the time you're finished, you won't be able to work. Be practicing much after you graduate. So that's just it. Yes, I want to be with a kid. Oh Lord, yeah. But most of the time when you see the folks with a cane and they're working for decades, years, and they're more consultants. So they're not doing much. But I was gonna say you have your providers who are walking around with their cane, but they don't really do anything much. They'll do like the grand rounds or so, or they do show for hospital rounding probably once or twice a week, and that's it. Them spend them time at their office, their private offices, and them a make big bucks. You understand? They're making a lot of money from hospitals just by doing that. So yeah, but it's something that if it is something that you still want to do and you're in that, age range where you still can pursue it and you have the funds and everything, and even if you don't have the funds, you have student loan, you can try to see if you will be able to get qualified and go in and do it, I can prepare as a master. As I study. Okay. Yeah. So that's just it. But I wanted to go back to school because I was thinking about doing psych only because, we're in the era of telehealth. And with psych, a lot of times it's always like telehealth right now. So I was like, okay, then after I leave America and go back to Jamaica, I can say, all right, then I want to do telehealth. So I was thinking about psych because with psych, you can practice basically from anywhere you're thinking. I'm saying like, yeah, I feel as though you can practice from anywhere. All right. When you're doing psych because it's all telehealth. I can practice telehealth now, but I don't want to be doing telehealth like for all my patients at, like every single time. No, I don't want to see them. So, but for telehealth, for psych, it's a little bit different. So I was thinking I would do that, but I don't think I would love psych like that. So it doesn't make sense I go into an area that I have no love for. That make no sense. That's gonna be a waste of time and just making you feel miserable doing a job that you're not enjoying. So I'm like, nah, I'm not gonna do that. Because I tell persons, don't go in any area that you don't have a love for. So if you know that psych is not your area, don't pick up yourself and go to psych just because you hear that the money is good. Because you go over there and you start seeing persons acting, differently. They're unstable, and then you get scared and you're not making the right judgment call, then that's going to be a problem for you. So if you love the area, definitely go into that area and start out in like if when you're working as a registered nurse, if definitely you want to go into psych years later, do your entire time as a registered nurse if you're able to, working along with the mental health population. And then from there, for me, I was in emergency, so I had a mixture of everything. Emergency is my love. How I ended up in primary care is because I don't want to be spending my entire life in hospital, working on call, working weekends, and feel as though I am just getting, all the work from the providers. Not saying I'm a lazy person. I'm not a lazy person, but I just feel as though that's what the nurse practitioners in the hospital are doing. You understand? The doctors just give them so much to do, and I feel as though some of them are practicing out of them scope. That's just how me feel. And I think it's more because of money as well. That is a driving factor for a lot of them to be taking all of those responsibility. But when I went into, the NP role or started to pursue this, this advanced degree or certificate, I was advancing myself so I can actually get more flexibility, not be tied down in any job. So I just feel as though those nurses are tied down. They don't have any time for themselves. Nah, that's not what I want. So even though they're making a lot of money, some of them are making a lot of money. No, they don't have any time. They're at the hospital sleeping. They get home, they're on call just the same. Like, nah, I'm gonna just do what is best for me, what I am enjoying right now, the flexibility, and that's it. Your teaching ways are excellent, very easy going. I agree. Stick to your area. Exactly. Yeah. So I'm actually, and then the other thing is, I'm enjoying content creation. I'm not a pro at it, but I'm enjoying helping the nursing students. So, yeah, who knows? Years from now, we'll see how that works out. But I don't want to be tied down in, I was doing what? Oh, how many years I did in emergency? About 10 years in emergency nursing. Like running around, getting up every day. You're going for work at 7 o'clock. You leave at 7 o'clock. No, can't do any more of that. Cannot do any more of that. I'm not that old or of age. So, yeah, I don't want it to be a case where when I'm 20 years in, because what, I'm 13 years in now, going 14. Yeah, I don't want it to be a case where I'm 20 years in, I'm still running around having arthritis and all of those things. Can't keep up. No, sir. I have to try and figure out a way. You understand, my way out. Still do something that I love, I will enjoy, and still be able to take care of myself. But this thing about inpatient, no. You have some persons who do love it, but as I say, sometimes they don't have any, let's say, boyfriend, fiance, spouse, husband, wife. Them just single and them just stay at hospital and sleep and eat and that's it. Them not have no life. And they're fine with it. You understand? I can't do that. I cannot do that. You can't be lonely for the rest of your life. No, sir. And then when you get so absorbed into that kind of work, that kind of habit in terms of a work, when you finally meet somebody, it's like you can't adjust. You can't adjust to it. Can I have the candy? No, sorry, you have candy already. No, go watch TV. I want the candy. 1 minute, please. Yeah, so when they finally get around to finding a partner, it's hard for them to adjust anything. And then when you look, what happened? Problem in a relationship, you still end up lonely. Like, no. You understand? I have a great day at the Home Depot for a few things to say. Thank God for his birthday, for me to say thank you for the first time. I am at the end. I am not at the moment. Jamal, welcome. I think you're trying to tell us that you're at Home Depot and you're happy, and yeah, welcome. All right. So that's just it. So you know, depending on what area you want to go in, feel free to go and do so. But at the end of the day, whatever is most important to you, look at that and take the time out to choose the best area to to pursue. And that's just it. That's the only thing I can say. Initially, when I was doing primary care, I was thinking I was going to be bored, but some days I really want to be in the hospital. Yeah, man, I want to put in my IV and my catheters, my NG tube, and the excitement of seeing all of those ambulances rolling in. Yeah, man, hearing, oh, we have a code blue, we have a CPR in progress. Yes, all of that, I'm missing it. But nah, after the shift, just feel tired. You might be working for the 12 hours, 13 hours. Some days I'll be working 16 hours. But may I tell you, I don't really feel tired until I get home. And forgive me, is when I go into the bathroom and sit down, is that time it's like a weight just come on my shoulder. Like the entire world is on my shoulder, my head at that time when I get home. I don't feel it for the 16 hours I'm working, And that's why I tell people, like, I might be feeling tired now. And by the time I get dressed, put on my scrubs, go in the car, drive out, I'm feeling so light. I feel as though, like, I'm not tired. I just have this burst of energy. And I go in, I do my 12 hours. And by the time I reach home, it's the same thing. I'm just feeling so tired. And then I get my 4 hours sleep, get back up, and it's the same thing. So, yeah, but I miss it. But not so much. As I say, I love the flexibility I have now. I'm renewing my TNCC certification. And somebody was asking, why are you renewing your certifications and you're not going back in the emergency room? I don't know. I don't know if I'm going to need it, but I don't want to have those certifications expire on me. And then when I really need it, I'm going to have to sit down and do the entire 2-day course. Like, no. I can sacrifice the 1 day right now for the renewal, because if it is expired and over 6 months from the expiration date, then you have to do the 2-day course that they have scheduled, and I don't want that. Yeah, I want to just do the refresher course and just get it out of the way. So I'll keep them active until, I'm not letting any of my certifications expire on me, because it's so hard to get some of them renew. And sometimes in terms of to find locations to get them renewed, it's another challenge. So so I'm getting that done next week, the 17th. Yeah, I'm gonna do that the 17th next month, and it's only gonna be online. So the other one is gonna be in person. So I'm gonna have to find a location to go and do it in person. Like, no, I don't have them time there, so I prefer to pay for it and just get it over with virtually, and then have it for the next 4 years, so I can have it in the event that I feel as though I want to pick up a shift in the hospital. Yeah, at any point. There was this company that reached out regarding travel contracts. When I said to them, I said, on the contract rates, them no good. Like, there's no money in travel nursing right now, so I don't really understand why you're gonna think that I'm gonna accept a contract for like say $2,500. That don't make no sense. That don't make no sense right about now. You need a contract, and then the 2.5 is like what? It's 4 days. They want it to be working. You know, it makes sense. I'm gonna find a full-time position and use my years of experience to get, you know, bargain for decent rates. But that's how I look at it. When I'm thinking about nursing contracts or travel contracts, I'm gonna be like, okay, then what's the contract? What's the contract rate? How much hours I'm gonna have to, you know, spend in order to get those? And then from there, when me do the maths and me know how much years of nursing experience I have and the scale, you know, looking at the scale and what hospitals are paying, I'm gonna be like, okay, what this not make no sense. Why would I want to leave my house where I have my bills and then go and use another location and still have bills there? And then the amount of money that you're paying me, it not even make no sense. No, just gonna find a full-time job and get all the benefits of working a full-time job, because you're gonna get insurance. Well, the insurance is the most important thing, but you'll get your insurance, you'll get a little life insurance, short-term disability. What else? Yeah, 401k. You'll get all of those with the hospital if you're doing full-time, and you're still getting the same rate as what the travel companies are offering you. So you just have to be smart about it. You have to be very, very smart and look at it. Can understand some new nurses. A lot of times you realize that the new nurses are the ones that probably accept some of those contracts because they don't have that much years of experience. So if a company is gonna come and say, oh, we're gonna give you this amount of money, they'll be quick to do it, because they don't have that much years of experience to say, okay, then if they have a hospital close to them, they can go to the hospital and tell the hospital that, oh, I'm looking for this in terms of my rate. No. So they're the ones that will be quick to accept those. And then the ones that have years of experience will be like, nah, that not work out. Let me go and get a full-time job. So if you are single, you don't have any, tons of bills, you are a new grad, then probably those are the jobs that, because it is paying you more, you'll be more, inclined to take. But at the end of the day, those are the jobs that I would say stay away from if you're a new grad, because they don't have much experience. And when you pick up a travel nursing contract, you're thinking about going into a facility that these folks are relying on you to come in and work, and they're expecting you to be competent. And if you're a new grad and you don't have all of those, what is going to happen? You're not going to be performing. They're not going to probably extend your contract. You probably be more, well, not probably, you're going to be more prone to making mistakes because you don't have that much nursing experience. You understand? So I would say stay away from those contracts. I don't encourage new grads or new nurses to do travel nursing contracts, because of the risk associated with, for the patient safety as well as their license. Those are the only two reasons I would say, because as I say, you're not thinking outside of the box. You're not that critical, not that much of a critical thinker, I feel, because they don't have that much experience to rely on. So just imagine you go out there, you're learning a new charting system, You're learning the flow of the hospital, the culture itself, dealing with the culture. Then you have your own skills that you need to work on because you don't get much when you're in nursing school. So that's a lot to be dealing with. It's almost similar to when you are an international nurse and you move from your country to this country and you have so much things to, deal with, adapt, in terms of like their system, their culture, the whole culture here. You have the culture in the hospital itself that you have to work on, the language, what else? You have to think about the charting system because some places we do paper charting and then come here learn how to type on computer, for your patients, notes, all of those things, administer medications via the computer. It is a lot. It is a lot. So new nurses going on travel contracts. It's almost, well, yeah, it's almost similar to your international nurses moving here and all of the challenges that they would face. So yeah. Welcome, welcome, welcome. How are you guys doing? How are you guys doing? I'm Stacy. Just chit-chatting here. Nothing really planned for today. All right. I have nothing really planned for today, except I want you guys to go ahead and subscribe to the Think Nursing Pro page. It's a secondary page to this one here. It is gonna be only nursing content posted over there, not vlogs, but actual contents like, teaching contents for especially your NCLEXs, new nurses, international nurses that need information. I'll share on that page. So do go over there and subscribe to the page. Oh, let me do what I saw some persons were doing the other day. Yeah, so just go over there and subscribe on the page there. Yeah. Oh, so this is it. See? I'm making it look bougie. I'm still struggling with content creation though, I'm still struggling with content creation. But the nursing live, like just popping up for a live and chit-chatting is fine. When I do the TikTok or because I do stream them on YouTube here. When I do the nursing live stream with where we're studying, I do enjoy that. I do enjoy it. What else? Yeah, but in terms of the edits and all them stuff, they're a headache. It's a lot of work. You understand? Somebody will probably say, hi, I got accepted into the nursing. Okay, nice. Congratulations, Nikki. Congratulations. You will be doing well. All right. So for you, I would love for you to go ahead and subscribe to this page. All right. I'll be posting a lot of information over there on the Think Nursing Pro. It's on my other page. All right, go over there and subscribe to that page. I'm going to share a lot of information regarding NCLEX nursing itself. So you can start from early to prepare. Just like when we're discharging patients from the hospital, we start when the patient just arrived at the hospital, we start doing discharge teaching. So it's the same thing for you. It's the same thing for you. I'm going to have you go over to that page at Think Nursing Pro and tell your friends about it. All right. So you can actually get started with preparing for your exam. And and if you're on TikTok as well, I'm on TikTok at Think Nursing. One word. We do nursing live streams at 7 p.m. Central Standard Time on Tuesdays and Thursdays. All right, so you'll be definitely benefiting from all of those live streams because we do a lot of questions and it will prepare you. I have persons who are not even RN. I have like physician assistants on the live. So medical doctors will be passing through and they'll be stopping answering questions. So it's pretty interactive. So do show up and be a part of it. They don't want me. Hi. How old are you? You want to know how much you be? Oh, Lord. I'm 30 plus. I'm going to say 35 plus. I'm over 35. 35 with one kid. Because at one time, there was a song going around, 35 and no kids. Yeah. So I'm over 35 with one kid. All right. Hope that answers your question. So, yeah. So we do all of those streams and I share additional additional information in my vlogs and little videos that I've created. But as I say, this page is going to be mostly about the vlogs, the live streams, and then the other page is where I will share educational content for your NCLEX tips, like for pharmacology, lab values, just about everything else. All right, so go over to that side and subscribe. Yeah. So what I have planned for the remainder of the day, Panthers walk. And where are you joining in from, Nikki? Shajak? Shajak? Where are you joining in from? I see I was gonna do, all right. I was gonna do, finish up my notes. Because I have, this is a part of house call I really like. This is a part I really like. So because I know I can't type that fast. And I think probably it's from back, yes, ThinkNursing Pro. All right, so let me pull it up so you can see it. I'm gonna try to pin it on the page there. So it's ThinkNursing Pro, one word. I'm gonna try to put it, how am I pin this thing again? Yeah, but this is a part of the nursing that I don't like because I can't type that fast, and I guess because I like to chart a lot. Yeah, I like to chart a lot because I want to be a case where if 2 weeks, 1 month, a year from now, I have an idea of what the patient look like. Yeah, so I chart a lot of information, so I think probably that takes up my time as well. But I work with this other company. I may tell you, say, the lady, she only writes probably like 2 sentences. 2 sentences. That's all she does for her notes. 2 sentences, the plan and the diagnosis, and that's it. And I say, so how long have you been doing this? She says 7 years. I said 7 years. I say, have anybody audited your chart before? But her chart is like to the point. There's nothing unnecessary in the notes. And I was like, whoa. Then I was working with another company, and it was like more of a textbook the nurse practitioner wants me to write. I mean, I say, like, all of these information, in a sense, it's just confusing whoever is gonna be doing the audits on these charts, if the chart is supposed to be audited. And there's just too much unnecessary things in the note. It's conflicting. But she says, so she wants her notes. So you just have to give it to her how she wants it. Then this company, I create my own, my template, and then I chart accordingly. But as I say, I think I chart enough to save my license. Yeah, chart enough just to save my license. So years later, I can see what the patient look like, because not all the patients may go remember. So I just chart enough for that. But I think I'm going to kind of cut down on it a bit. Because some days it's a lot. Especially when it comes on to like your annual wellness visit. If you're doing an annual wellness visit and the actual regular visit at the same time, it can be a lot. It can be a lot. So I'm going to cut down on that and just get straight to the point. Especially if they're not that complicated. If the patients are not that complicated. Like some patients, they go into the hospital every 2 weeks. Yeah, those patients, you have to spend time and do the notes on it, because I don't want it to be a case where I miss something and then somebody come and say, well, you just saw the patient. How is it that the patient died? Yeah, so, all right. So subscribe at ThinkNursing Pro. All right, so I'm pinning this thing here. Oh, there it is. It's popping up. And then I pin it. Did it pin? Okay. So it's pinned at the bottom there. So go ahead and subscribe to that page. It is the one for if you're a nursing student and you want to have all your nursing contents in one page. It's gonna be on that page at ThinkNursing Pro. So go ahead and subscribe to that page and support me. Watch the videos over there. Leave your comment. Any questions you have, feel free to go ahead and ask me. I also talk about being an international nurse. So if you have questions regarding transitioning, feel free to reach out to me as well and ask any question, and I'll be more than willing to answer. Yeah, I'll be more than willing to answer any of those questions. Let me see if anybody has subscribers yet. Nah, I only have 5 subscribers over there. 5 subscribers, but eventually I want it to grow, organically. I don't want to be a case where I ask persons to subscribe to the page and they never want to subscribe to the page, and then what happens is that they become like a inactive subscriber because they're not that active on the page. Yeah, so I just want it to grow by itself, and from there. All right, no problem, Nikki. Not a problem. So do you have any area that you'd want to go into after nursing school? Or that is just too early for you? Do you have an area that you want to... Or you want to call me, Nikki? Who wants to talk to me? Who wants to talk to me? Because this is not like TikTok. On TikTok, the folks will just pop up on the screen. That's what I like TikTok saying. I like TikTok. TikTok have a vibe. And if you don't know, I'm going to tell you. Go over to TikTok, create an account, and follow my page as well at ThinkNursing. All right, follow my page at ThinkNursing over there. But may I tell you, TikTok have a vibe. It's not all negative, I must say, because I was very, very hesitant about going onto the TikTok platform. I did create the page like for over about a year or so. I had the page. I was posting 1 and 2 things, but I wasn't really interacting on the platform. But may I tell you, I started, and it depends on the kind of energy that you bring. So if you have a negative energy and you're feeding negative things, that is what, is going to be coming back to you. So you have to tell the algorithm what you want. So if you don't want a ton of negative energy, then you don't feed it. All right. So for me, I have a lot of nursing students that pop up on my page, and you have persons that are just passing by, here a Jamaican nurse, and just stop by. So I do like the energy over there, but I love the fact that they're able to come, just like we have a little screen here, persons can send your request. And if you feel as though you want to accept them, I can just accept that person and we just have a regular conversation. Just like when you're sitting over there and you're just listening, and rather than you typing, you could be responding to me. I could be seeing you from wherever you're at, and it just feels good. It feels like you're more connected with, your audience, and I love it. So that's just it with TikTok. So for YouTube here, I started something like that because I wanted persons to call in, especially nurses, and just kind of talk about their day in the life. So I don't know who wants to, I don't know if Nikki, do you want to talk with me, Nikki? I know it's kind of off but I used to pin my number here. Can I pin more than one things? Let's see. And then whoever wants to call me, you can call me on TikTok, not TikTok. Call me on WhatsApp, or you could call me on the regular call. Let me see if I can do that. So we used to do that at 7 o'clock in the evenings, and then things kind of got busy with work. Oh, you're cleaning. Okay, no problem. No problem. So yeah, so we used to do that where persons would be talking, we just have conversations. I'm gonna try to pin it there. So whoever wants to call, let me see. So yeah, so we used to do that where persons. Yeah, but then at one point persons, I think let me kind of get the picture though. They got the picture. Like they were trying to call not call like at odd times, but they would send in, you know, messages that I want to have regular conversation. I'm gonna really have, I don't have enough time for them stuff there. A lot of students are saying nursing school is hard, and I'm gonna say it. Yes, nursing school is hard. All right. It's like, so let me tell you, where are you? Let me just find out. Where are you now, Nikki? Are you in the US or where are you currently? You're in St. Vincent. Okay. All right. So, St. Vincent and the Grenadines. Okay. Okay. Nice. Let me see. Let me see if I can pin this. Can you pin? Or you only can pin one thing? You only can pin one thing. All right. But yeah, if anybody wanted to talk, you can call me on that number. I'm going to leave the one for the ThinkNursing Pro there, because I want persons to subscribe to that one. But yeah, so nursing school is hard. All right. We're not going to tell you that nursing school is easy. School is never easy. And then with nursing, you have to be proficient. All right. Theoretically, you have to be. And then when you get into the clinical side, yes, you need to be competent. All right. Because remember, you're dealing with patients' life. It's all about patients' life, saving patients' life. So it's going to be a lot of work. You're going to have to put in a lot of time, a lot of work into it, but it's manageable. Remember, this is something that is going to be new to you in terms of learning about nursing, how to become a nurse. So it's something that is new. And if it is something that is new, you know, you don't really know how it is to be a professional nurse, and somebody's teaching you about it. Once you learn it and you understand it, then it's something that is a part of you. It's easy for you to be a nurse. You understand? So for the 4 years that you'll be in nursing school, yes, all the content that they're going to be sharing is going to feel as though it's hard. It feels as though you're going through hell, because you have to be learning so much information, preparing for exam, and then preparing at the same time to sit your license, you know, like your RN license exam. So it's going to feel overwhelming. There are days you're going to feel as though you want to give up. But if this is something that you really want to do, you're going to push through. All right. You have other persons who have been there, they've done it, and I'm still doing it today. 3 years, okay, they're still doing it today. And they will tell you that it's the same thing. Everybody go through that whole experience with nursing school being hard. So it is something that is doable. You just have to make sure you plan. You know, you have a calendar, timetable with things in terms of how you go about with getting your assignments done in a timely manner, so you're not feeling as though you're overwhelmed because you're not practicing good time management. And if you start from early with time management in nursing school, that is something that will go a long way with you, especially when you get into the nursing field, working as a registered nurse, because you're going to realize that time management is very, very important. And for somebody that is in the Caribbean, if you're planning on moving to the States here, you'll realize as well that time management is something that you need to be on top of prior to coming to the States here, or else you're going to be left alone a lot of times. All right. You'll be leaving work. You'll be the last person leaving from work. You probably have tons of patients that are doing a tons of, you know, different tricks on you in terms of their status. And you're just left behind with your patients, because not all the time you'll have, you know, assistance from others to help you. So work on your time management from now. As I say, nursing school, it's all about learning. That's the time you're going to be making your little mistakes, and you learn from them, and just prepare yourself for the working world. Oh, you used to live in Canada. Okay. Yeah, so it's not easy. You have to take a lot of responsibility for your learning. It's not any, you know, you go into the classroom and they spoon feed you with everything. No, it's not like that. So if you're thinking like that, no, you have to do a lot of adult learning. you have to do a lot of adult learning. The information that they teach in classroom is just like, a small portion of it. Just a small portion of it. So that's the only thing I can say regarding that. But it is going to be hard. Some days, as I say, you're going to find yourself just crying because probably you can't get the content, especially when it comes down for pharmacology. Pharmacology is one area that a lot of persons do struggle with. But start work on those areas, and then from there, all right, make sure you have your dictionary, your medication dictionary. I know persons don't use it nowadays because we have the good old cell phone and everybody is learning from chat and all them stuff there. So we don't bother buy the pathophysiology textbook. We don't bother buy the med surge textbook. We don't bother to buy the medication or the drug guide, because we have the ebook. For me, yes, technology is nice, but me prefer to write, because when I write, when I underline, I visualize, I remember when I write. So that's just it for me. I think I tend to retain more when I have the physical textbook. So try to use that. Even if you're an ebook kind of person, you might be an ebook person because you love to read. But for nursing, I just feel as though you have to have some of them textbook there for you to flip through. You understand? You have to have it. Oh yeah. So let me show you. It's my little dictionary here. This is one of my little dictionary. This is my regular dictionary. Yeah, I wonder, how is it that I still have a dictionary? Yeah, man, I walk with everything. Now I like a dictionary because, there are certain things I still not remember. I don't have my drug guide because I did give my drug guide to somebody when I was in Jamaica. But I do have my textbooks. I do have my textbook. I have a pathophysiology textbook. And I did got my advanced pathophysiology textbook as well. Because as I said, there are certain textbooks you have to get in nursing school. I just feel as though if you're going through nursing school and you don't have those textbooks for yourself, you're not a nurse or you're not a nursing student. So I do have my textbook for pathophysiology. I did have my med surge textbook. I have all my notes on flash drive from one of my friends who is in nursing school. Okay, but I would say make sure you get a pathophysiology textbook. Get a pathophysiology textbook. I understand that you probably have it on flash drive, but go ahead and get your pathophysiology textbook. Because if you don't know pathophysiology as a nurse, you're going to fail. All right? I'm not that 100% good with pathophysiology, but I know enough to say, okay, then to save the patient's life. But go ahead and get your pathophysiology textbook and understand it. This is which one? I think this is the advanced pathophysiology I use for my NP. Yeah. But go ahead and get your pathophysiology textbook so you can actually sit down and read through. And then from there. So I have two of these. So the pathophysiology med surge is good as well. Get a med surge textbook. Get a drug guide. And a dictionary. If you don't want to get anything else, you don't have to. That's just how I see it. If you don't feel as though you want to get any other textbook, you don't. Because pathophysiology is going to tell you about the disease process. And you need to understand that. If you understand that, then you know how to treat your patient. And you're going to be anticipating the signs and symptoms. All right. So in terms of with your critical thinking, which patient, prioritization, delegation, things like those. If you understand pathophysiology, if you're understanding what is going to be happening with a patient that is asthmatic, who is having shortness of breath, you can anticipate what kind of medications you're going to need. And you can anticipate who you're going to delegate that patient to. You'll know, oh, can I send this patient to the LPN, or do I need to have the UAP or the registered nurse, things like that. So you have to have your pathophysiology under, wraps there. Which edition? So for this one, as I said, this one is, let me look online here. That one is the one for my advanced nurse practitioner. So that wasn't the one that I used years ago. But they should have one that you can, I don't know which one they recommend for your nursing school. So I think the one that I used was Mosby. No, Mosby was the med surge. There was a Burgundy med surge textbook. And even if you have that one, Med Surge Mosby. Even if you have that one, you should be fine. You should be fine if you have the Mosby. Because nowadays you realize that everybody has a review course. And that's one thing I keep on telling persons. Like, nothing is wrong with having thank you, Olivia, for tuning in. Nothing is wrong with having the review courses going. You understand? Review courses are good. But I just feel as though you have to have your foundation. If you don't have your foundation, it makes no sense you're going to sit down now and review class. Because sometimes when persons are doing review courses, I come and tell you what me can remember. You understand? I will tell you what I can remember, and I'll tell you how I remember it. But it doesn't mean that it is always the only answer or the only way to do certain things. So you have to study broadly, and then you go and do your review courses, which is going to help with narrowing down a little bit. So this one, I don't think this is the price though. No, this is not it. This is it doesn't look like they have it again, that one. You understand? So make sure you read, you understand, okay, then how asthma, what's the pathophysiology behind asthma, and not just get a review course that is saying asthma is caused, you have bronchoconstriction, you have excess secretions, things like those. You need to understand the mechanism behind how the patient come about with having bronchoconstriction. What receptor site is being affected. You understand? Why is there increase in secretion? Why is the patient hypoxic? You need to understand all of those. And then from there, you can pick up your review book. Because what that does is it makes you feel a little bit more narrow-minded. You don't really get a chance to think outside of the box. And if you're doing that, yes, you'll go in the exam and you probably see the answers. And because you're not seeing the answer that somebody tell you about in one of those review courses, and because you haven't studied broadly to understand the pathophysiology itself, you can't answer the question and you come out failing the exam. So must be med surgical nursing book. Okay, so Brunner and Stoddard, or Stoddards. So this is the updated one. Yeah, okay. So the price, it's expensive though. It's $197 because when I purchased mine at the time, when I was in nursing school, I spent almost $14,000 for it. That was Jamaican dollars. It was pretty expensive. But I did ended up buying it because, as I say, it's very, very thick. It's about this thick. Yeah, so every day I walk with it go to school. It was the only book with my drug guide. And even when I go into the hospital, it was the same thing. So this one, I'm going to try to, this is what I'm going to do. I'm going to save it. And I'm going to pin it onto the other page, or I'll pin it somewhere. Yeah, I'm going to put it as a post on the other page. So just in case when I get a chance, you can look at it. I'll post it on this page as well, just in case you don't get a chance to subscribe to that other page. Post. How do I do this again? Okay, post, and then this one. Oh, nice. Okay, so I posted it on the other page, so you can take a look at it and get that one. As I said, that's the one that I had in Jamaica, but it was a red one. And even up to probably like 3-4 years ago, someone was still using that textbook. And how long now me graduated from nursing school? Long time. So, okay, for nursing students. Oh, yeah, I'm making use of my post section. So this is it. All right. So go over there, look at it, and then from there you can get that one. But you can't go wrong with having your med search textbook as well as your pathophysiology. And I look up one of the pathophys textbook that I use. But as I said, the price, it might seem like it's a lot of money because $197 is a lot of money. But you wouldn't need to buy another book for your entire 4 year. So I got that one for the first. Okay. I got that one for the first year. First year when I started nursing school, I got that and the pathophysiology and the drug guide. And as I say, it was worth it. It was worth it because I was able to leave those in Jamaica with another person that was going to nursing school. They used it, benefited from it. They never buy any more book and then they hand it off to somebody else. So you ever hear about hand me down? Yeah, man. So it was worth it. And then the other one would have been the pathophysiology. And both of them, the textbook are very, 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 very thick. And if you're able to get the pathophysiology made incredibly easy, some students had this, and may I tell you, it was good. So if you're able to get this, because this is what we photocopied and and use it some days. Yes, it was very, like, it was very concise to the point. So it was very, very good. They have it in the EKG as well. EKG made incredibly easy. So you can take a look at those. But as I say, you can't go wrong with the two textbooks that I'm suggesting to you because it's going to help you throughout nursing school because it gives you the management of the patient. So it's not like you have to go somewhere else to find out what the medical management of anything is. You have the disease process, the medical management, what else? You will have care plans. So things like those are in that textbook. So that's why the textbook is so big. And then, let me see the one for pathophysiology. Because as I say, you have a lot of review courses out there, but that's the part where a lot of persons tend to get it. I understand that we all need to make money, but you have to have the foundation. You have to have the foundation. Get the review course at the end when you're preparing to go and do your exam. And that last 3 months, you can say, okay, then I feel as though I am ready to go do my NCLEX or my exam. Let me just get one of those review courses to just get to the point and the answer, rational, and that's it. Oh, you want me to put it back up so you can screenshot it? I don't know if you're still here, but I don't know if you're able to see it properly. Because it seems as though, I think you're not going to pick it up properly. I don't think you're picking it up properly. Yeah. All right. So what time is it? 4 o'clock? Didn't I say it was just 2 o'clock a while ago? So I'm going to try to finish up those. So remember, go ahead and thank you for the thumbs up, guys. All right. I'm going to go ahead and try to, I'm creating a, so what I'm trying to do, I'm going to try to see if I can do a boot camp as well. I'm going to try to do a boot camp. So I'm creating a course where you can do like a boot camp and we do like small study groups. So rather than me spending what, 4 hours? 4 hours on a Thursday, 4 hours on a Thursday, and then probably 3 hours on a Tuesday, and then the students are asking for other days. Like that's how much hours? 4 hours on one day is what? 4 and 3, 7, and then just let's say we do another 3, 10, 13. They want 13 hours out of my entire week. You ever hear anything like that yet? They must say come on Fridays too, huh? No, so I'm creating a course so I can actually get the students to study in like smaller group, and then I'll try to do like a boot camp where we study a little bit more on those days. But yeah, 13 hours out of my day, out of my week, each week is like a lot of time. Not true. Yeah, man, it's a lot of time. So I need to put it to, making it work for me. So I'm going to create a course and try to have those individuals who are wanting like the one-on-one study session. I can't do, any too much of the one-on-one. I'm going to do like small groups so I can focus on, their needs, their weak areas with them, and then from there. So that's what I'm trying to create. But I did sign up for the subscription thing, and it's something so expensive. It is like so expensive. It's like $110 for the subscription. And then the students, not a problem. Thank you. Not a problem, Nikki. That's what I'm here for. All right. So feel free to go ahead and reach out at any time. So that's $110 for the subscription. And then, sometimes I come on the live and there's questions. Well, at least there is only one person who said it. Like one person was passing through. I don't know if they were just trying to be like, oh, yeah, I'm an A student. But anyways, I never really paid them much attention. I never really paid her much attention, yeah, man. Because may I say, there's so many other persons on the live. Because I had probably like 140 something persons on the live. Oh, you're a Seventh-day Adventist? Okay, nice. Yeah. I never really pay her much attention. She was like passing through the live and she was like, oh, the questions are like so easy. And I'm like, that kind of mentality. Yeah. Because some persons in the live, like a lot of persons on the live were getting it incorrect. So obviously the live was benefiting the other folks. So I was like, okay, then no problem. So she was like, I need to find another live that has a little bit more of a difficulty, with the questions. So I'm like, chat, go ahead and tell, Mademoiselle where she can go and find another live. So I don't know where she went, but she was saying that the live was I don't feel as though the live stream or the questions are easy. The whole aim of it, because I don't feel as though right now, in as much as I'm providing a service, I think right now to be investing almost like $1,000 to get UWorld subscription going, and then to find to give it's $1,000. That's a whole heap of money. $1,000 is a lot of money. You understand? To be just getting up every day and say, okay, let me come and sit down and do NCLEX questions with folks. Yes, it can be something like, charity work. If you want to look at it like that, me doing something for the folks. But $1,000 is a lot, is a lot to be spending on, to be giving away free content. And I feel as though I spend a lot of time. I spend 3 to 4 hours on a live stream just chatting, and it's free content. So I don't know why she was like, making reference to that, but I don't know. But either way, when I am studying, it's more like a study session. We go very, very deep in terms of the content and make sure that persons get the content. I don't want it to be a case where I'm there teaching and 4 persons in the live, I ask a question and they put up the incorrect answer. Like, no, I'm going to stop and focus on those 4 persons because they're interacting. The mere fact that they're engaging in my chat, it means that they're listening. So I'm going to focus on those persons that are giving me the answers that are incorrect. The ones that are already getting it, yeah, A student. So the ones that are chatting and they're saying, okay, then the answer is this. No, if 4 of you guys or 2 of you guys get it incorrect, I want it to be a case where you're engaging. So I want to spend the time to focus on that question so we can all be on the same page when, so that's just it. So mine is a little bit different from probably other persons that are doing their questions and just running through the answers and then, oh, the answer is A, you read the answer, you read the rational, and you move on. No, if it's DKA, if it's hypertension, I want to ask additional questions regarding the topic before I move on, so we can feel like it was worth it. I don't want to feel as though, oh, I spent 1 hour and we only did 60 questions and you only know 60, 60 different topics or whatever it is. No, I want when you leave, by the time we do 60 questions, I can ask you 6 questions from 1 question. So you get what? A total of 6 hours, 360 questions in 1 hour. That sounds like a good deal, right? Armando Camarillo, welcome, welcome, welcome. How are you doing? So that's what I'm working on. So I'm going to try to do a little boot camp. I'm going to work on the subscription, like a subscription service. So persons can actually come in, have access to me for a certain time period. We sit down and do the smaller group. So I'll focus my 4 hours or, how much hours on those individuals. And then I'll still do my larger group, the free content on TikTok and YouTube here. But I won't be spending 4 hours. I won't be spending 13 hours a week, almost 15 hours a week, just giving away content like that. That's like a lot of time. That's why sometimes I'm going to bed, I'm tired. I can't wake up in the morning because I come to bed 12 o'clock, 1 o'clock after doing a live. Because even sometimes at 1 o'clock, the folks still on TikTok asking for more questions. And I say, huh? Are you guys serious? You know what time it is for me now? Sometimes it's even 5 o'clock for some of the folks and they're still wanting more question. After me just done the 4 hours worth of question. I'm like, no, sound serious. But then you have some persons who are saying that they have exam in 2 weeks time, 1 week time, a month. So they're trying to just maximize on the amount of questions that they can get or the content that they can cover. And then the other thing about it is that sometimes you might see 1 and 2 persons that comes on the on the live and be like, oh my word, I was on your live the other day and a lot of the questions that you talk about showed up on the live. So that feels a little bit nice. It feels, it feels good. Like I'm doing something good. I know I'm doing something good enough, but you can feel it. You can feel it at that time. So it's a nice little feeling. I do enjoy it. So I'm going to continue doing it, but I'm not going to be spending so much time doing the free live streams. Just be doing 4 hours every day. No, we're going to do a little subscription. So I'm working on that. It's going to be pretty reasonable. I'm going to do the boot camp. I'm going to do the boot camp so at least we can say, all right, and you can spend $100 or $150 and you get 90 days worth of content. And we study together and you have access to, different things that I'll post. So I'm going to try to make it be very reasonable because these are nursing students just the same. But it must be reasonable and it must make sense because of all the different subscriptions that I'm going to have to be paying to get those things going. All right, because I really want them to have the content that is similar to the nursing exam. And that's why I really want to get the UWorld content because it is similar to. So if I can start teaching them that kind of, way of thinking. And that's what I'm doing because when I talk about the high yield questions, answering your select all and apply questions, understanding what priority means, what delegation means, what first mean, it's basically the same concept. It's the same concept with answering the questions because they're similar to NCLEX. It's just that the folks from UWorld, some of those persons do sit on the board for the NCLEX. And so they have a better idea of how to create those content or questions. But none of the questions that are out there are actual NCLEX questions. They're NCLEX type. And that's what I study with. So, yeah. All right. So definitely, Nikki, you found my page at the right time, or probably you found my page from before and I just didn't realize. But you found the page at the right time, and as I said, there's going to be a lot of things that I'll be sharing on the page here that will benefit you. All right, so just feel free to go ahead and ask me any question when you get a chance. And I did put my number in the chat, so you can feel free to text me on that number or WhatsApp me. WhatsApp is better. Yeah. And follow me on TikTok as well at ThinkNursing. ThinkNursing, it's one word. So feel free to go over to TikTok. If you're on TikTok, just look me up and follow me. Mm-hmm. All right, so I am going to finish up these notes, and then I don't want to play any music because when I play music, YouTube copyright my music. So yeah, I don't want to play any music. So when I do that, it affects my channel, not directly, but in terms of the video, it's, you know, sometimes you feel as though it doesn't make any sense because you can't it's not broadcast, or it cannot be played in certain places in the world. So because of the music on it. So when your nursing program starts, Nikki, if you're still here, when your nursing program starts, I remember when I was doing my nursing program, yeah, it was a bit of a challenge doing some of those nursing courses. Yeah. As I said, for me, it was more like initially doing statistics and microbiology, like those, never really like it, never liked those courses. So at the time with the nursing program, I don't know if it's the same thing now, where you have to, like if you fail a course, then you get dropped out of the program for a year because the courses are not offered like, you know, right around the clock each semester. So if you fail a course, then you're out of the program for 1 year, and then you have to resume the program the following year. So that was it at the time at my university. And so I was like worried that, you know, doing some of these courses together was just too much because, you know, you're there in nursing school and you don't want to fail any course. You don't want to fail any course. And they were so structured. So it was a case where you have to do, like, you know, you have to do part 1, part 2. So they basically dictate how you go about with doing your courses. So if you don't do, like, you know, the summer, then there's a possibility you won't advance to the next semester because you won't have completed the courses. So it was something like that. And I was doing biostats at one point with microbiology, and I was like struggling because microbiology is hard and biostats is hard. I said, no, sir. And it was a summer. So it wasn't like you had the entire semester. It was a summer. So it was what, 6 weeks? Only 6 weeks you're doing that 2 courses in. And they are 2 hard courses. I don't know how I ended up with doing biostats and microbiology together. And I had to make the decision to drop on the course. I had to, because if I never drop, because so when I started on nursing school, I started doing teacher education. And so I had, like, you know, what do you call those courses? It was the non-nursing courses, the general courses that I was doing at the time. And so because I had done a few of those courses for the general courses, I was a little bit advanced when I started the nursing program. And so I was trying to make sure that I am still doing the amount of credits that I needed to do. So when I get into like the Kingston campus, which would have been like the 3rd year, I wouldn't have that much courses to do. And so me go pick up this thing and say, oh, I'm going to do microbiology and biostats together in the summer. Usually you do microbiology first summer, and then you do microbiology second summer. So you don't do both of them in the same term, and you don't do any other courses with them because they were like 3, I think it's 3 courses, 3 credits. I think it's 3 credits each. Yeah. So you just do that one. And me go pick up biostats on top of microbiology and couldn't manage it. I couldn't, because microb was killing me, and then biostats was another headache. And so I had to, you know, drop one of them, because what I did was I realized that I wasn't doing well with the biostats. But if I had focused on biostats, I would probably fail microbiology. But I needed microbiology to advance. So I had to drop, you know, when I realized that this thing not working out, I just dropped biostats and say, yeah, when I reach third year, I can do biostats. Biostats is not important right now. And so drop biostats, did microbiology 1, and then did microbiology 2, and then advanced. If I had done it the other way and kept both of them, probably I would have ended up failing and would have sat out for like 1 year, because as I say, I wouldn't be able to do the course the following semester because of how the nursing program is structured. But you have to make that conscious decision when you're in nursing and find out what is important, which course is important to take now. Because if you don't, sometimes you might just be in a situation where you're failing or you end up failing the course and then you get sit back. So I don't know if your program is like that, where if you fail a course, you know, you won't advance. But I know a lot of schools were like that at the time. Yeah, so. But biostats, biostatistics. I love maths, but not that kind of maths. Yeah. All right, so I have this note that I have this patient that I sent to the hospital the other day. I went and saw him on, when was that? Today's what, Sunday? When was last time I worked? Wednesday? I went and saw him on Wednesday. So he was complaining of some left abdominal pain. It was a bit tender. He was having nausea. He was having dizziness. But he has been having dizziness and nausea for a while now because he feels as though his VP shunt has shifted. But I said to him, you need to go and see you need to go to the hospital and get a scan done to see exactly what's going on. And he said, no, I'm not doing it as yet. He's waiting until he starts vomiting, because then he will know that, you know, the shunt is actually shifted completely. So I'm like, oh, okay. I say, you need to call your neurologist. I think he did call the neurologist. I don't know if he had gotten through to them, but yeah. So he went in at one point and he got that fixed. I think he's having more problems with it. So I sent him back again this time, but he's having abdominal pain and he's still having the dizziness. So I need to follow up with him next week to see if he is discharged from hospital. So I'm doing his notes. And then from there. Yes, I was saying the notes, that this is the part that I hate. This is the part that I hate, doing the notes after, because I can't type that fast. I wish I was able to just talk and, you know, just dictate. It does dictate sometimes, like when I'm on the road and I have my little note that I am, but it doesn't organize my notes entirely. So I wish I had a scribe that I could actually just be like, you know, telling them what to write, and they just fix up the note and I'll just sign it and done. But yeah, I'm gonna reach them levels there yet. But aside from this is the part that I hate, but I still do spend the time to make sure my notes are good, because this is what is gonna save me years from now, months from now. Yeah. And remember, guys, go ahead and subscribe to my Think Nursing Pro page. All right, that's the nursing page where I'll share only nursing content, especially if you're in nursing school, you're NCLEX, or you're thinking about nursing school. You can always go ahead and subscribe to that page and just get only nursing content. All right, over that side. On this page, you'll find me doing live streams and vlogs. You know, a little mixture of everything on this page here, but that page is gonna be for all your educational content. All right, so this is some. And as I say, if you know anybody that is doing any form of volunteer services and they're looking for persons to be a part of their team to go to Jamaica, I am one of those persons who are wanting to go down there. All right. So hit me up. Let me know. How are you doing? How are you doing? Should I turn on the light here? Please, kind of dark. I guess. All right, so I will see you guys. I will see you guys in a bit. I'm gonna try finish up these 4 notes, and then I think I'm gonna go onto TikTok later on. Yeah, I'm gonna go onto TikTok later on and do a live. All right, so I will see you in a few minutes.